Hey everyone, in this video, I felt that it would just be best to do a big video discussing all of the information that goes on in the neck area. Uh, if it feels like we need to break it down a little bit more, please leave a comment below. Be glad to do a video. But until then, we'll stick with this. So it might be a little bit longer of a video, but let's dive in. So here we have the hyoid bone sitting here. It's free floating. It's held in place by all the muscles that attach to it, for sure. And you'll see that in the next couple of tabs. But right underneath it, we have this thyroid cartilage, right? And if we've got thyroid cartilage and we have the hyoid bone, this is going to be the thyrohyoid membrane sitting right here. Okay. Underneath it, we have our cricoid cartilage. Um, and sitting right underneath this thyroid cartilage. So cricothyroid membrane sitting right in here. All of that is that cricothyroid membrane. Then we have our thyroid gland sitting here. On the back side, let's just isolate this for a second. These little dots back here, those are your parathyroid inside, right there. There's two pair of two. And then you see the trachea right underneath and your tracheal rings. Posterior to this is going to be your esophagus. If we remove some things here, might be able to see it just a little bit better. Again, there's your cricothyroid membrane in between those. Thyroid cartilage, let's remove that. Let's go ahead and remove this. Sitting right above the opening to your trachea is your epiglottis. This will close as you're drinking and eating. That way it covers up your airway so it doesn't go down the wrong pipe. Unless you're like me and it just seems like every time you drink water, it does not go down the right pipe. And then you just sit there and you cough for forever. But that's that right there. Let's go on to the next section right here. We're going to look at some of the muscles. So, looks like a lot. Promise you, it gets pretty simple. So, we've got that sternocleidoid mastoid sitting on both sides. I'm just going to remove it here. Now we're starting to see some of the familiar things, right? There's our hyoid bone, the thyrohyoid membrane, thyroid cartilage. Then this muscle right here, it's going from the sternum down here to the hyoid. So it's going to be your sternohyoid muscle. Let's hide that. Underneath it, that's where we find the sternothyroid muscle. Lies directly underneath that sternohyoid muscle. Let's see. Lateral to this sternohyoid muscle, we have our omohyoid sitting right here. And it's like, holy cow, we know that there's supposed to be two parts to it. So this is the the superior belly. I was getting ahead of myself. This is the superior belly. This is the inferior belly. And I'll keep that there, and I want to show you how far this muscle goes back. But let's keep going. Lateral. Here we have that sternocleidoid mastoid again. I'm just going to go ahead, leave that right there, just so you can see it. Now I'll remove it. There we go. Now we can see that omohyoid muscle a little bit better. But it looked like underneath that sternocleidomastoid mastoid, this muscle is almost invisible. It looked like it was just hiding. This is your anterior scalene. So it goes underneath that omohyoid, but it's not directly against the other scalenes. You have 3 scalenes. This one is unique because right behind it, that's where your brachial plexus is. Your brachial plexus is what your body uses as the start of a nerve that comes down into your arm or your brachium, and then into your antebrachium. That you'll notice as well, this nerve, it goes in between your anterior and middle scalene, but also goes underneath your omohyoid, and then it bifurcates. So, anterior scalene, middle scalene, posterior scalene. And you can see that they like to connect into your transverse processes of the vertebrae. That's where they like to kind of connect into. And then a lot of you guys know this muscle right here, your trapezius. Let's go ahead and hide that. And there's our inferior belly of the omohyoid, and it goes clear back to your scapula or your shoulder blade. And then this muscle comes off of your superior angle of the scapula right here. This is your levator scapula. Okay. Wasn't that bad, right? One more tab. So here we go. After covering all those muscles, we can see how everything fits in there again. And hopefully you're looking at this and you're like, okay, I think I can go ahead and name them all. Sternocleidomastoid, omohyoid, anterior scalene, middle scalene, posterior scalene, levator scapulae, and then trapezius. Coming back around to the front, here's these muscles again, right? They should be pretty simple. Going from the sternum to the hyoid, sternohyoid muscle, right? Now we're going to get up here and look underneath the mandible. The most superficial one that we can see is that digastric muscle. This is the anterior belly. It's got 2 bellies to it, just like the omohyoid. This one connects right there in the bottom, right where your chin is, and then it goes clear back to this mastoid process right underneath the sternocleidomastoid. I think I showed you in an earlier video the stylohyoid muscle running from the styloid process of the temporal bone down to your hyoid bone. It splits, digastric muscle comes into a tendon, goes through that split, goes through the digastric sleeve, and then creates that anterior belly. Removing this, now you can see that this is the mylohyoid muscle, and it is running from left to right. It's running on that horizontal plane. Directly underneath it, we have our geniohyoid muscle, and that runs down right there. You can see it. If we remove this muscle, any guesses on what this next one is? If I remove this, you'll be able to see it a little bit better. This is your genioglossus muscle. So there's all the muscles of the neck. We covered some of the other things that are in there. Hopefully this helps. If you found the video helpful, please like it. That way I know that this video is sufficient and I don't need to redo it. and go ahead and subscribe, and we'll see you in the next video. All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.